Hi, my name is Mike Ryall, and this is my video for medication pass of Warfarin and Coumadin to Mrs. Jenkins for my nursing school at SEMO. All right, now the first thing to know about medication pass is you must remember the 6 rights of medication pass. And those 6 rights being that it needs to be the right patient, the right drug, the right dosage, the right route, the right time, and at the end, the right documentation. Those are key, and you need to go through those 6 rights to prevent med errors. Now, uh, for now, what we need to do first before we go and pass a med is we need to confirm that our physician orders and our MAR information matches. And so what I want to look at is I want to look at the physician order, which is for Mrs. Jenkins to receive 2.5 milligrams of warfarin by mouth daily. And then when I go and check that to the MAR information, I see that it says that she will have 2.5 milligrams of warfarin Coumadin by mouth at 1800 each day. And so those do match, and we can continue from there. Now, quick information about warfarin Coumadin is that it is a anticoagulant medication, and it works by inhibiting the enzyme that activates vitamin K in the body, and by deactivating vitamin K, that will decrease the clotting factors of the blood, so it will prevent blood clotting. And now the reason for Mrs. Jenkins taking this medication is that she is currently 1 day post-op from a partial right hip replacement, and she has a history of atrial fibrillation, type 2 diabetes mellitus, and also hypertension. And with these pre-existing factors and her state in post-op, she is a high risk factor for throwing a blood clot and having any sort of related injury from possibly having blood clotting in the body, such as MI or DVTs or pulmonary embolism. So by giving warfarin, we can hopefully prevent that from happening. And now the 5 side effects that you want to watch out for with warfarin Coumadin is because it prevents clotting, it does increase your risk factor of bleeding and how much you will bleed. So things to look out for would be hemamesis, which is bloody vomiting, hematuria, which is blood in the urine, black tarry stools or bloody stools. You would also need to be careful for ecchymosis and petechiae, which would be sudden bruising on the skin even though there's no trauma that's happened, or small blood red dots that appear on the surface of the skin. All right, now the lab values that we are most interested in with looking over with Mrs. Jenkins before giving this would be her PT and her INR, and she has a PT taken at 0.715 today. PT is at 18, and her INR is at 2.2. Now, normally INR, which is related to clotting time, for a normal person would be between 1.3 to 2. However, because she is on warfarin Coumadin, I would expect that we'd want to keep those levels between 2 and 3. We wouldn't want it to go higher than that or lower than that. So that is good. And now what I can do is I would wash my hands and then go check on Mrs. Jenkins to see if we can have her take her medications today. Hi, Mrs. Jenkins.
Come on in.
Thank you. My name is Mike Ryall. I'm a student with a student nurse with SEMO, and I would like to give you your scheduled dose of Warfarin Coumadin today. Is that all right with you?
That is fine.
All right. Now, before we go on, could you please give me your name and your date of birth?
Mrs. Jenkins, January 7th, 1947.
Very good. Okay, and let me just check your wristband to make sure you are who you say you are. Okay, I want to make sure that you're in a good position to possibly have medication, see if you're comfortable. I would elevate your head of bed so that you could swallow up, medication, but you're sitting right now.
I'm sitting.
For all intents and purposes, you're sitting right now. Alrighty. Now, the Warfarin Coumadin that you've been scheduled for, that is an anticoagulant. It prevents clots from forming by inhibiting the enzymes that activate vitamin K and by extension that will reduce clotting factors. And that'll help prevent you from forming any blood clots that you could develop with your history of atrial fibrillation and hypertension and being post-op at this time. So is that all right? Do you understand that?
That's fine, yes.
Okay, very good. And just a few side effects that you might notice that I want you to tell us about if you see them. If you notice any blood in your stool or in your urine, or if you notice any bruising suddenly appearing on your skin that you don't know how that suddenly started appearing, you would just need to let us know about that right away, all right?
I could just call you, right?
Yes, you could
Call
just,
the nurse.
yep, call us immediately or let your physician know. Okay. Now, I know that you had been feeling nauseous earlier. Are you feeling nauseous right now?
Not at all.
Not at all? Okay. And now, have you had any other side effects with taking Coumadin or Warfarin before?
No, but I know I bruise easier than I used to.
Okay, understood. All right, and do you have any pain right now?
A little bit from the surgery.
Okay, very good. Scale of 1 to 10, where would you say that?
I would say it was about a 3 along the incision.
Along the incision, 3 out of 10? Okay, very good. All right. Now, I see that you have some water right there. Is that good for taking the medication?
Sure.
All right, now I'm going to go that medication for you right now, and we'll get that, and we will have you take that, all right?
Very good, thank you.
We'll be right back. All right. Now I'm at the MAR, and I would want to, of course, check my order one more time, for the first time, right here at the MAR before opening it. And I want to check that it is the right drug, right dose, right route, and the right time. It is 1800 right now, so we are at the right time. Mrs. Jenkins is the right patient. And so we need to get our by mouth Coumadin 2.5 milligrams. So I'm going to pull that out. I have the bottle here. I'm going to check. And this is for Warfarin Coumadin 2.5 milligrams in 1 tablet. So that is confirmed there. It's the right time. We are checking our second time here as we are going to put our dose, capsule, single tablet I should say, here. I'm going to put that back away. Now take this back to Mrs. Jenkins. Right?
Yes.
All right, Mrs. Jenkins. One more time, could you give me your name and date of birth?
Mrs. Jenkins, January 7th, 1947.
Perfect. Okay, I
You
have,
want to check?
and I am checking that wristband, and that is correct. And now here's your Warfarin, 2.5 milligrams, 1 tablet right here. It is the
Okay.
right time, and so you'll just take this. Here's your water. All right, going down well? All right,
No problem.
no problem? Can I see? All right, very good. Want to make sure you're not cheeking it for me.
No.
All righty.
I wouldn't do that.
Wonderful, wonderful. All righty. Are you in a comfortable position right now?
Yes.
Okay. And I will check to see if for your pain, if you're scheduled for any pain meds right now.
I think it's another hour.
Okay, very good. But if you need anything, let us know, all right?
Okay.
And now I would want to document that she did in fact take her medication at 18:05 exactly. Document that right away in her MAR. Alright, and if you need anything else, give a call now.
I will.
Alrighty. Wash my hands on our way out. And that concludes our med pass for Mrs. Jenkins.